Good evening, everyone. My name is Denise Mananas. I'm the Marketing, Public Relations, and Development Director for St. John's. Tonight, we are here to learn about the Zika virus, and we have invited Dr. Peter Berkey, who is sitting right next to me, to discuss the virus. Dr. Berkey is the Chief of Infectious Disease at St. John's, and he has been in private practice for 28 years in Yonkers. And welcome to our first live stream of an educational program. We have audience members here, and hopefully we have audience members out there in cyberspace. So we will be taking questions from our audience here as well as from those on social media. So welcome aboard, Doctor.
Thank you, Denise.
All right, so what we're going to do is I'm going to just start with asking you some general questions, and then you can respond to those. So why don't we start with the basics, which is, what is the Zika virus?
The Zika virus is a virus that is very similar to other viruses that have circulated throughout the world and is transmitted by the bite of a mosquito.
Okay, and so all of a sudden we're hearing about it on the news, so where does it come from?
Well, this virus has actually been known about for a very long time. It probably was first described in the literature 50, 60 years ago. But originally, it was not known to infect other humans. However, over more recent years, there have been occasional cases of this virus in other parts of the world. And of course, most recently, we are now seeing a large number of cases that have been occurring really throughout the world.
Okay, and so tell me, you've talked about these other places in the world, where are they?
Right, so originally, these current cases of Zika virus were first described in Asia, in parts of Africa, and in the far Pacific part of the world. However, within the last year, we started to see really an explosion of cases in South America, in Brazil, in Colombia, and now what we're seeing is the spread of this virus into most of Central America, Mexico, and because of the sort of global way in which the world is connected through airplane travel and people traveling throughout the world, it's not surprising that we have started to see cases of Zika virus being reported in the United States.
So that brings me to my next question, which is how many cases are documented in this country?
Well, of course, these numbers are really changing from day to day and week to week, but the last number that I saw was for the United States, approximately roughly 80 cases that have been reported in the U.S., most of them in Texas and Hawaii. Some of the other states have had a few cases. It's important to note that of the cases that have been documented of Zika virus in the United States, all of those have been so-called imported cases. That is, people who were traveling, who got infected with Zika virus while they were out of the country, came home, were diagnosed as being ill with the Zika virus. So to date, we have not had any cases of Zika virus homegrown, if you will.
Okay. So that's very interesting. There's a lot of concern, obviously, that the virus will come to the United States and that people will be able to get it here. So can you talk a little bit about the spread and, obviously not the people who've brought it in, but getting it actually here, and what's the reality of that?
Well, of course, it's always difficult to make exact predictions when it comes to new emerging infectious diseases. That being said, I think the general sentiment has been that the types of outbreaks of Zika virus that have been seen in other parts of the world, in Brazil, in Colombia, and Central America, are less likely to occur here in the United States, having mostly to do with climatic conditions here, the fact that we have areas, large areas of the United States that typically have colder climates or less conducive toward breeding of mosquitoes. We have better sanitation systems here. We're more cautious about stagnant water, for example, that is a breeding ground for mosquitoes, the Zika mosquito. And we have air conditioning, and we have screens, and all these very fundamental things make a very big difference in terms of preventing the types of outbreaks of this virus that we're seeing in other parts of the world.
Okay, but now we have spring is, we hope, around the corner, and there are a lot of concern that there are mosquitoes here that can bring the virus, and so there is a lot of people, there are lots of worry going on out there. You have anything?
Well, there is a lot of worry, and anytime there's a new infectious disease that comes along, people are concerned about it. I think it's important to note that this is not the only mosquito-transmitted infection that we have had to deal with here in the United States. In fact, I think a bigger concern with Zika virus is the fact that it's not just Zika virus, it's other viruses such as a virus that is called chikungunya virus, another virus that is called dengue virus that has been diagnosed cases in Florida, for example, and another virus that is called West Nile virus. Now, all of these 4 viruses are transmitted by mosquitoes, not necessarily the same mosquito, but nevertheless mosquito transmitted. And we have been seeing cases of dengue and of chikungunya, usually in people that have been traveling. But I think it's notable that Zika virus is not the first mosquito virus to come along, and that we're seeing several other similar infections with similar symptoms for the last several years, and I've been seeing some of these patients in my office, as a matter of fact.
All right, well, that brings up a good point. What are the symptoms that people should be looking at, whether it's for those other viruses, but particularly for the Zika virus?
Well, it's generally speaking a mild illness. For people that do become ill with Zika symptoms, the typical features of that would be fever, headaches, a rash, the eyes will become red, or what we call conjunctivitis. Patients will have joint pains frequently. All of these things are usually self-limited, meaning that they have sort of a time span of a couple of days before the person starts to get better in almost all cases. And it's usually a relatively mild illness. It's important, however, to state that with Zika virus, the majority of people who are infected with Zika virus do not become ill. 80% of people who contract Zika virus will never know that they have it because they will have no symptoms whatsoever.
That's very interesting. Tell me, though, there's been a lot of press about the possibilities of, when you're pregnant, or if you're choosing to become pregnant, and having this virus and some of the related problems that brings.
Right, so the whole issue of pregnancy is something that really seems to have gotten everybody's attention, and rightly so. In Brazil, in the last year, they have seen a larger than normal number of babies being born with a condition that is called microcephaly. This is a congenital condition that is characterized by what you see is a baby with a distinctly small head. And to date, there have been approximately 4,000 such cases reported in Brazil of this congenital condition. Now, this is really an observation and a science that is evolving, which is to say that it is not really clear that all of these 4,000 cases of so-called microcephaly are necessarily related to the mother having had Zika virus. And the scientific data that shows that Zika virus is absolutely, or that these congenital abnormalities are absolutely a result of the mother having had Zika virus, is still not entirely clear and is something that is being looked at currently to see if, in fact, there is a clear-cut relationship.
Does it make a difference if the mother has had the virus and it just is over it, or didn't have any symptoms, as compared to an acute episode when and being pregnant?
Well, it would make a difference, yes, because if the mother was not pregnant and got Zika virus, and a period of time went by, and then the mother became pregnant, it seems as though there would be little risk to having a child with any congenital abnormalities related to Zika virus.
So let's talk a little bit about how we diagnose this virus.
Right, so typically I think a doctor might see someone coming back from a country where Zika is known to occur, which is a lot of countries around the world, let's say South America or Central America, and a patient will present with the types of symptoms that I previously described. The doctor then has to sort of give what we call a differential diagnosis, meaning that the doctor prepares in his mind a list of things that the patient could have, knowing that that individual has traveled to a country where there are many infectious diseases, not only Zika, but some of the other viral-related illnesses that I mentioned earlier, such as the chikungunya infection, dengue infection. And from a clinical standpoint, meaning when you see the patient, you can't say that this is one virus as opposed to the other. So it really requires blood tests usually to make a determination as to whether or not the patient has Zika or has any one of many different viral illnesses that can circulate and cause similar symptoms.
Okay. So let's talk about treatment. So if someone does come in and they do have Zika, and it's an acute episode, what kind of treatments are available?
Well, again, I suspect that most patients we're not going to see because they're not going to necessarily become ill, but if they do, like many viral illnesses, most of them in fact, there really is no specific treatment for Zika virus. The treatment is what we call supportive, which basically means stay in bed, rest, and take Tylenol, and wait for this illness to pass, which it usually will within a few days. There have been some cases of what is called Guillain-Barré syndrome. This is a neuromuscular disorder that has been described after many different viral illnesses and has been recently described in South America as a possible, and I say possible because again, these things are still not clearly determined, but as a possible complication of Zika. Guillain-Barré, of course, is a serious illness. It's characterized typically by weakness and paralysis that usually starts in the lower part of the body and ascends to the upper part of the body. So these cases have been a lot in the news recently. Their relationship to Zika virus, again, is not 100% clear, but that would be the most serious complication other than the pregnancy situation that we talked about a moment ago. Again, most people with Zika virus either don't even know that they're ill or they're going to have a mild illness that's going to get better on its own within a short period.
So you spoke a little while ago about the fact that you have to be bitten by a mosquito that carries the virus.
Yes.
They are, or are they not present in this country?
Yes.
At this point,
Yes.
they are.
Yes. Yes, except that the climatic conditions here, as I mentioned before, are not typically conducive for the large spread of mosquito-transmitted illness.
Now, we are seeing in the press other modes of transmission or somewhat documented modes of transmission, the sexual transmission of the virus. Can you comment on that?
Sure. Well, the first case of what is thought to be sexually transmitted Zika virus infection was actually described several years ago in a mosquito researcher who had traveled to South America, came home, became ill with symptoms that were compatible with Zika virus, was diagnosed to have Zika virus, and apparently transmitted from this man to his wife. She became ill. She had never traveled. And that was the first case of transmission, sexually transmitted Zika virus infection. More recently, there have been another such case in Texas, in Dallas. But again, it's important to note that this is an infection that is affecting thousands of people around the world currently, and yet at the current time, the possibility for sexual transmission appears to be very low, just based on, to date, the low number of cases that we can point to where we can say Zika virus was in fact sexually transmitted.
Okay, so how can New Yorkers prevent this? As I mentioned earlier, we're moving into the spring season, rainy season. What can people do to prevent the transmission of the disease or getting the disease?
Well, again, in a sense, we're fortunate to live where we live. That we don't live in a country where we don't have screens on windows in most cases. We have air conditioning. All of these things really do a lot toward the prevention. But you don't want to have sort of pools of stagnant water. I mean, we do have people who garden, they leave buckets and pails, and these are ideal breeding grounds for mosquitoes in the summertime. That's the kind of thing that I would say that you can prevent by just not doing that. People who travel, I think, is a bigger issue. And of course, we have a lot of people who travel back and forth, and when people travel, they need to know that this is transmitted by a mosquito, and therefore mosquito repellents are probably one of the the most important things that you can do from a standpoint of prevention. But of course, you can't prevent it entirely. But mosquito repellents, an environmentally protection agency rated mosquito repellent would be important.
Okay. So I'm going to turn to the audience here. If anyone has any questions.
A couple of questions. So it's my impression that the 80s mosquito was one of the mosquitoes that didn't require a breeding ground of, water, and that was one of the reasons it was so, that plastics and just sanitation was more an area rather than, a water environment, and that's why one of the reasons that the 80s mosquito can be so prolific. First question is number one. Second, or comment on that, the second question is, have they looked at antibodies to the Zika in Brazil? If they raise antibodies to see if they have a high titer, or are there tests to look at antibodies to see if they have a high titer of the IgG, for instance, antibody in the people with, the pregnant women with microcephaly.
Right. So to your first question about the 80s mosquito, these mosquitoes do like to breed in wet, warm, water environments. And that's why, again, it's very important to not provide those types of environments where possible. And one of the reasons why in countries such as Brazil you have the military that is going around house to house in an effort to educate people about breeding grounds for the mosquito. And of course in those countries, stagnant pools of water are much more common than here. And so that is a very important way to try to eradicate this epidemic. The issue of antibody testing is a very good question. It's an important question because that's how one of the ways in which this infection gets diagnosed. So after the person is bitten, they do develop an antibody response. They develop what we call an IgM and an IgG antibody response, and that can be measured with a blood test. We have physicians here tonight, and it occurred to me that some of us may want to know about testing in our offices, for example, for Zika virus. So the Department of Health has a system in place currently for doing Zika virus testing. And it starts basically with identifying people who we think are at risk. And of course that would be somebody who had traveled to a Zika country, who has symptoms that are compatible with Zika, and or a pregnant woman, for example, who has traveled to a Zika endemic country or who has been with a partner who himself has been in a country where Zika virus is prevalent. In those cases, if somebody presents to your office, after you do this questionnaire that is provided by the Department of Health to try to determine who may have Zika and who doesn't and who you need to be concerned about, you can call the Department of Health and they will essentially give you an approval to send the patient to a central testing area. There is actually one up at Westchester Medical Center that is the designated center for this area for doing Zika testing, and there are others in the Bronx and of course around the New York area where you can get this done if you need to and if the patient qualifies to get it done. Testing is done really with two different types of tests. It's done with an antibody test, an IgM and an IgG antibody, and it is also done with a test that is called a PCR. And for those of you who don't know what a PCR is, it's a genetic test that looks for a piece of the virus genetic map to identify it conclusively. And so the person can actually get this special PCR test done on both blood and a urine specimen. So we do antibody testing to diagnose it, and we do PCR testing of urine and blood, but again, it has to be done through a process in which you have to first speak to the Department of Health about the given individual patient that you're dealing with, and then send the patient from there to a designated center to have the blood drawn.
Is there any vaccine on the way coming to, protect us?
Right. Right. Everyone likes to know about vaccines, and of course this came up recently with the Ebola epidemic and the development of a vaccine. And the problem with vaccines is that they take a very long time to develop, years in many cases. And often by the time the vaccine is actually available, in many cases, the pathogen or virus in this case that it was developed to combat has already passed. And by the time you test these viruses and they get approved, we're talking typically about a period of years. So as a practical matter, there is no vaccine for Zika virus on the horizon currently. And though it may be in the future that there is a vaccine that will be developed, it is probably going to be years away, like most vaccines that take a very long time to manufacture, test, and then get to the marketplace. And by that point, the question is it still relevant just based on what's going on?
With different viruses, we have different lengths that they are last in the body. Like HIV can last a lifetime, but do we know how long Zika can last in the body? Because, for a young woman who still wants to get married and have a child, is if she has Zika, would she be at a higher risk to have a deformed child born?
Right, so the time period for this infectivity or carrying the virus is still very much in question at this point, and I'd like to sit here and say that I have all the answers about this, but I don't, and honestly I'm not sure anyone does so early on in the course of studying this. But 4 weeks is sort of typically a time period in which I think you could reasonably think that if a person were infected, that they would have cleared the virus by that point in time. The virus stays in blood and other body fluids for probably a week to 2 weeks.
So I think it seems like we have to be more concerned about pregnant ladies here. Otherwise, it is a milder infection. So my question is, the infection in pregnant females, it has to be in the first trimester or throughout pregnancy?
Right, so again, this is one of those areas that is simply not known at this point. We do know, generally speaking, that when a first trimester fetus develops any viral infection, it's usually more severe because that's a very critical period in the development. But that said, it is really not known entirely as to whether or not a mother who's infected later on in pregnancy couldn't still have complications as a result of Zika virus infection.
Okay, so I have a part B to the same question. Let's say if we diagnose a pregnant lady with infect, can we treat, can we prevent the congenital defects or no?
Well, I don't think there's really any way to prevent. What one would do in that setting is, of course, to go through the testing process, and that's important to do, and get the IgM antibody and the PCR, because if it's negative, I think then you can reassure the mother, and that's important, and then you probably can reduce the number of sonograms that you're going to be doing on this mother during pregnancy. If it's positive, that's obviously an entirely different situation in terms of what happens from that point forward.
One last thing. The sexual transmission. So the person has to be actively ill when the sexual transmission happens, like.
I think it's difficult to make any generalities about this because we're really basing this whole notion of sexual transmission around 2 case reports at this point in a series of thousands of cases of Zika virus that have been reported. So I wouldn't speculate about that at this early time.
Okay, thank you.
Hi, Dr. Berkey. I know you explained Zika virus in a pretty detail. One of the things what you mentioned, and I think I agree with you about the sexual transmission and the microcephaly, because there was a research which was done in France in 2008, and I'm sure you might have read that. They found that the Zika virus does cross the amniotic fluid. They found it out by PCR. And the overall infections of microcephaly are so low comparatively. So I know we cannot take stance on here or there, but looking at that, what do you think?
Well, I think that I would probably hesitate to make any definitive statements about it. I just don't know at this point, and I'm not sure anyone really knows about the specifics of all of this at this time. Thank you.
So, one more, Peter. We give a lot of blood here. What about the New York Blood Center in terms of, do you know what they're doing as far as, donations, and as far as what we should be doing as far as anything special?
Right, so the potential for Zika virus transmission through blood transfusion, or even for that matter through organ transplantation, is something that is theoretically possible and which has been described with other viral illnesses, other arboviruses, that is, other viruses that are in the same family as Zika virus. So it would not surprise me if we were to see, in fact, cases of Zika virus being transmitted through blood transfusion or through organ donation for that matter, because we've seen it with every other infection, if you will. That said, at the current time, to the best of my knowledge, there is no recommendation for blood banking for screening for Zika at this point. That may come. It will depend on the number of cases that we end up seeing in the months to come, particularly the summer months. But at this point, all of the cases of Zika virus, with perhaps one exception, have been imported cases, and we're talking, at least in the United States, about somewhere of the order of 80 cases, so I don't think we're going to change our blood banking screening procedure based on that, but I think it remains to be seen what happens going forward.
Hi, I'm Kelly. I'm a student from LECOM. If you have a pregnant patient who is infected with the Zika virus, do we know if any antiviral medications would provide any benefit?
There are no antivirals that are currently available for Zika virus or for any of the other viruses that are similar to Zika virus. I think it's an interesting question because it does raise the issue of future development of an antiviral, but I would say that it would probably be a good idea for the pharmaceutical companies to develop or try to develop an antiviral medication that has activity not only against Zika, but against some of the other mosquito-transmitted viruses. I think if they could do something, then we really would have something quite valuable, just given the number of people that are infected with these mosquito viruses throughout the world.
How about plasmapheresis? Do you think there's a role of that
Not at the current time.
at the current time?
So where did they get this name Zika? Why did they call it Zika virus?
I knew someone might ask. So I started off by saying that Zika virus has actually been known about for a very long time. And the name comes from the Zika forest in Uganda, where it was first discovered approximately 70 years ago. And at that time, it was actually thought to be a viral illness that primarily involved other animals and primates, but not a disease of humans.
Because it says that it's been in Africa and then lots of zebras there. I was wondering whether that had anything to do with that.
I like the question, but I'm not sure that there's any relationship there. Thank you.
Can a patient get infected more than once, or once you have it, you have lifelong immunity?
I don't think the answer to that is no.
Do you think it's wise for pregnant women or women of childbearing interest to defer travel to the Caribbean, for example, at this time, or is that premature?
I don't think it's premature at all. I think it's a very real concern, and I think the current guidelines are that persons who either are pregnant or trying to get pregnant really should not be, if at all possible, traveling to countries where Zika virus is endemic. So that does put a significant burden, if you will, on people who need to travel or want to travel, but that is the current guideline at this time.
Hi, my name is Ludmila Aurora. I'm a medical student from LECOM. I know Zika is a hemorrhagic virus, and you mentioned rash and conjunctivitis as some of the symptoms that occur. Are these two symptoms necessary in addition to fever in order to raise suspicion for a Zika virus in a traveler?
Well, the presence of a rash, the presence of joint pains, the presence of red eyes, or what we call conjunctivitis, fever, those are the non-specific complaints that would raise the issue of Zika virus, as well as other viruses that are similar to Zika virus. Zika virus, however, unlike, for example, dengue virus, is not a virus that is known to cause a hemorrhagic fever. So that's not one of the things that it typically does. In fact, I don't think I have ever heard of hemorrhagic complications as a result of Zika virus infection. It is just as a practical point in treating these patients. I was asked earlier about treatment. It's really mostly supportive care, but it's advised that you not use aspirin when treating these patients or other non-steroidal anti-inflammatories, because initially anyway, you may not know for a while if it's Zika virus or dengue virus. And patients with dengue virus, as I mentioned, can have hemorrhagic complications, and by giving those patients aspirin or non-steroidals, you may predispose them toward bleeding complications.
Well, thank you all for joining us. Dr. Berkey, thank you very
Thank you.
much. Thank you. Good night, all.
Good night.
Thank you.